A very, very good morning, everyone. Today, we are going to speak on and discuss regarding the global evolution of quality systems and standards as to how these standards have come in picture. We try to see some parts of the history of how quality systems have evolved, its relevance to the healthcare sector, as well as we would also like to evaluate as to what are the next future outcomes or what expectations we can try to identify with the systems or with the current trends that are in place. So, without wasting much time, I also request the other participants they can just mute their mics and cameras to save the bandwidth. And we will take the discussion forward. You can put your queries in the comments or in the chat box, and I'll be happy to answer them in the last part of this webinar. So, in today's discussion, we would like to just highlight on 3 points. That is the definition of quality systems, its importance across industries, and broadly into healthcare, manufacturing, services. And basically, what is the objective as to how to trace the evolution and what is its impact on global quality standards? So, that will be our main agenda of the day. So, just to quickly go back to the history of the quality systems, how the early roots of quality control started. It started way back in the ancient methods of craftsmanship that was in Egypt, in Greece, China, when the old craftsmen used to make handicrafts or you can say handmade textiles, handlooms. So it was that time when the craftsmanship evolved and it gave a you can say a very concise structure and shape to the quality systems in the very primitive stages. Then, of course, as we know that the guild systems in medieval Europe started, where the emphasis was on apprenticeship and mastery, wherein there were guilds which used to, kind of produce certain items in mass numbers, like pottery, like certain, you can say, uses of daily wear. Like we used to have packaging material, like those jute bags. So those were the old, you can say, primitive systems wherein emphasis was mostly laid into apprenticeship, into mastery, and into certain skills that were needed at that time. But the actual rise or the actual shape that quality system or quality control methodologies took shape was during the Industrial Revolution. So, in Industrial Revolution, since the demand was high and the production was surplus, there was a rise in inspection-based quality methods. And of course, as we know, like how the birth of modern quality control thinking started. So it was in the 1920s when we had control charts. So Walter Shewart from Bell Labs, he had very clearly in the 1920s brought the gambit of modern quality control, modern quality thinking from his control charts, from where a lot of data inference could be drawn. And then, of course, in the 1940s, when the World War started, World War One, World War Two, mainly World War Two was of pivotal importance because somewhere there were competing economies, competing countries. The quality of the weapons that were being used in the war was a very major question in concern. And that is where in the 1940s we had Deming, Joseph Juran, who were the fathers or founders of modern quality as we know it on date. And then, of course, as we know that total quality management, the roots began to take after the war. So we'll talk about total quality management also in the next slides. So international standards, international standardization, from where that process started was exactly from 1959 onwards. We had the first MILQ 9858, which is the US military quality standard. This was the first time we actually were able to understand and identify that there was a proper standard, a proper document of reference, which came in 1959. And then, of course, in the 1960s, 1970s, we had the rise of national standards, like the British standards came in the UK. Then we had the Canadian standards. And finally, in 1987, we had the launch of ISO 9000. The ISO 9000 family was from the International organization for standardization, the ISO standards as we know it today. So, going a little, you can say, further as to what exactly you can say was the development post the ISO standards, post 1987. So, as I shared in my previous inference, that the ISO 9000 family, it gained traction globally. And then, of course, the sector specific standards began to emerge. So we had a standard for medical devices, that is the ISO 13485. Then we had an automotive standard, that is the IATF 16949. And as of today, we know that in healthcare and laboratories, we have the NABH and the NABL standard, which is, you can say, referred to across most of its sector specific requirements. And then, of course, as you can say, the maturity towards higher or better standards, better systems was, you can say, conceived per se in all sectors in industry. So the process kept on emerging, it kept on evolving. And what we came to understand, like what we now call as TQM, that is the total quality management, and lean thinking, it took shape in this period. So in 1980s, and of course in the range of 1980s, 1990s, we for the first time came across the terminology called TQM, or total quality management. So total quality management implies that you take into account everything which involves the product or the service and don't leave apart any specific area or non-concerning entity. Because when you have a total control, a total, you can say, approach towards the system or the process, you are able to accordingly modify, accordingly control, accordingly direct, and accordingly operate on the definition or the standard requirement of the quality parameter that you have set. So with that, of course, when the TQM methodology, it gained its popularity worldwide. For the first time in 1986, we had Six Sigma as a concept. So Six Sigma was basically one concept wherein the number, it's a very good tool for production processes. And of course, when the data set is extremely high, extremely large, so there is a discipline. It's like, you can say, doing meditation on a daily basis, and you have a time committed for your activities, and you can say areas of your, you make it in a structured shape that you will dedicate, or you will, perform at this level or at this defined, you can say, pattern of, you can say, your consensus or conscience. So Six Sigma, what the main, you can say, the idea was that suppose I am manufacturing, let's say, 100 items, or the end product is defined to a number, let's say 1000. So there is a number which is, kind of a measure of the sigma value. So Six Sigma was one aspect which became a very major deciding factor in the production outputs of the company. So in Motorola, what they did, they had a term called DPMO, defects per million opportunities. So let's say the number of products or the number of opportunities was, say, 1 million. So they had very specifically mentioned or very specifically categorized 3.46 defects per million opportunities. That was the Six Sigma level of performance or output driven methodology of perfection or quality. But yes, of course, as we all know, Six Sigma was more of perfection driven, excellence driven. And of course, quality as we know it in services, in manufacturing and production, it's a slightly intangible kind of a proposition. The definitions, the wear and tear, and there are a number of factors, including environmental, persons. So they keep on fluctuating, and that is where the quality system comes into play, where it aligns the overall gambit of these fluctuations and ensures that the production outputs are actually in control or in the hands of the correct requirements, and the wastages are minimized because of such fluctuations. And then, of course, as of now, what we know, the world famous, one of the best referred to systems in manufacturing, lean manufacturing, that comes from the Toyota production system. So, as we all know, that Toyota is one of the companies, one of the leading manufacturers, and they have very excellent quality standards. The vehicles that they deliver are definitely, undoubtedly excellent. The engines are refined, the build quality is good, and even the, you can say, refinement. A lot of things are in place. And despite the major challenge being the Toyota production system, of course, Toyota is a company from Japan. And as we all know, that Japan doesn't have much of land availability, because they are a small island and they are surrounded by the waters from all four sides. And there are a number of restrictions when land comes into play. And of course, there are earthquakes and there are a lot of geographical factors which were deterrents in manufacturing of quality vehicles, quality four-wheelers, as we know. What Toyota did, they introduced something called as JIT. Of course, we'll have a different webinar if time allows on it. So just in time used to be one of the concepts, JIT as we call it, where the items that were required on the floor when the order was placed by the customer. So it was just in time that the material, or the, you can say aspects of production were introduced, and then the vehicle was delivered. So that saved Toyota, of course, a lot of space from the, you can say, end product storage viewpoint, as well as, of course, they did a lot of, you can say, cutoffs in their overall manufacturing principles. So that led to something called as lean. So you have a very short, you can say, reporting pattern in which the product problems are identified and addressed very quickly. And that is where lean manufacturing principles, definitely they are referred to as one of the best principles that we know. And larger organizations, they are asked to, kind of adopt to lean. And lean is definitely kind of one of the critical milestones, as we could understand, wherein it has actually changed the pattern how we perceive quality, or how quality management systems should be aligned to. Now, coming to the 21st century, that is as of now what we are in the process. So, there are two words, that is integration and digitalization. So, we need to understand very clearly, quality is not about being flamboyant or lavish, or kind of showing off to your competitor that kind of we are superior. It is more about identifying sustainability, identifying with safety, and identifying with what customer needs, and at a price point that is acceptable to both you as a manufacturer or a service provider, and me as a customer. So that is what is the implication or the understanding. And apparently, yes, as we see 21st century, when we have a lot of integrated systems, integrated thought processes in place, and of course, a major role has, you can say, come in the aura of the gambit of paperless working, that is digitalization. So there is a lot more availability of data. There is a lot more digital footprint on the processes that we do. And there are a number of tracers that we can identify and eventually correct our systems, take correct decisions. Data driven decision making can be implied. So, what happens if we see to the current practices, or the current pattern of how things have been in the last few years? So, as of now, what we all know, as I had previously put off in my slides regarding the evolution of ISO 9000 family. So the ISO standards, as of now, we have the ISO 9001 2015 version. We are being, of course, undergoing a new revision. Most likely it comes out in maybe 2025 or 2026. But then as of now, the current, you can say, the standard of reference is the ISO 9001 2015 version. And this standard is a very generic standard. It can be applied to all sectors, manufacturing, production. And its main objectives, or its main, you can say, points of gravity are two aspects, that is risk-based thinking and leadership focus. So when you have addressed your business risks and you have a focus on leadership, and of course that comes with the customer-centric approach, you anytime qualify to apply the quality standards, that is the quality management system standards in ISO 9001 version 2015. Then, of course, this 21st century poses a very interesting integration with sustainability, that is the environmental standards, ISO 14001. And of course, safety, that is the occupational health safety. We have human resources at stake. So that is the ISO 45001, which was previously also kind of its roots come from one of the OSHA's 18001 standards, that is the occupational health safety and assessment systems. So as of now, it is a very systematically defined under the gambit of ISO 45001. And of course, integration and digitalization are eventually leading to something called as digital QMS or EQMS as we call it. It is a digital quality management systems. These systems, of course, when integrated with more intelligent thought processes, data-driven decision making, are set to revolutionize the quality in the future as we understand. Now, in the terms of in connection to global health and development, as we see, so there are connections, of course, because eventually, kind of when quality systems evolve, it's adjacent or it's connecting industries, service providers also evolve. In the context of global health and development, if we see how quality has, kind of taken shape, so we have a very pivotal role of WHO's role because WHO provides us benchmarks, it provides us data, it provides us certain reporting parameters, and of course, a lot of guidance documents come from the World Health Organization. Then, as we know, PMJY, that is the Pradhan Mantri Jan Arogya Yojana, and of course, number of hospitals in the private sector are into NABH. For the government or the public setups, public health centers, we have the NQAS. So these are two standards which have also been, you can say, very effective in terms of developing or in terms of effectively improving the quality systems in healthcare. And as we all know, of course, the global health accreditation bodies are also expanding influence. The most recent, you can say, identification in the current ISO standards is ISO 7101. So ISO 7101 is a very specific and a very targeted standard for healthcare quality management systems. So we highly recommend ISO 7101 if healthcare industries would like to, healthcare quality management systems would like to emphasize and bring unilaterality in terms of global accreditation, global quality definitions, and a global consensus. So ISO 7101 is a very interesting, you can say, aspect to study, and as well as how the future of healthcare will evolve. So we are very closely monitoring ISO 7101, how things are developing. Adaptation as of now in India is low, given that already a number of healthcare providers are already NABH or NABL accredited. But yes, there is a very bright future when it comes to international standards because now we have a definition, a very specific guidance document available. And this has just been recently. It was not prior to 2023 because the ISO 7101 standard was, in fact, introduced in the year 2023. Prior to 2023, we did not have per se a very definitive healthcare quality management system. And therefore, there were a lot of gaps and there were a lot of ambiguities when we used to, kind of refer to quality in the healthcare sector as a whole. But now, thanks to the ISO 7101 standard, that ambiguity is totally gone and we have much clarity and much systematic inference in place. So, what are the challenges and trends ahead? So, the first challenge that we see in terms of a quality management system is that we have to balance compliance with continuous improvement. Compliance on part of the regulatory bodies, and of course, the compliance from the importers as well as the exporters, and of course, The government policies keep on changing from time to time. So we have to have a very clear consensus on compliance. At the same time, we also have to continuously improve. So both things have to go hand in hand. Then, of course, the other challenges are that we, anytime in any system per se, in healthcare or in manufacturing, when it comes to the amount of data that we handle is humongously high. So it's not a small set of data. Okay, there was an Excel sheet and there was only two or three data points and that's it. No, it's always you find that it's a daily monitoring or it's maybe an hourly monitoring or a weekly. I mean, it's slightly a bulky data that involves data driven decision making. So definitely when that kind of high amount or high volume of data is involved, we have to integrate, we have to understand, and we have to, kind of make out pathways where AI, that is artificial intelligence and data analytics, can come in picture and they can make things easier for the decision maker to follow and imbibe upon. And of course, as we know that with all these things said and done, the customer experience and of course the ethical standards, they are emerging and the customer is more aware, the customer is more demanding, the economies are growing. So we somewhere identify that the focus on customer experience and ethical standards, it is going to only emerge with time. So the faster we adopt, the faster we are able to address and become first movers in this direction will be where we are able to gain momentum and establish a proper sustainable quality management system. So to conclude, I would like to just bring across my endpoints and notes as follows. So what we now understand in a much clearer and a much uh, concise manner is that quality has evolved from inspection to innovation. So previously we used to have like in the pre-World War era, it was all about inspection, how we are able to, inspect and you can say achieve perfection from the workman or the factory worker. But now it is all about innovation, how we are able to capture data, how we are able to innovate, and how better smartly we are able to deliver our service with proper quality system. The second factor being global collaboration and adaptability are key. As of now, if I sit at, you can say, one place and just you can say create a closed ball of a small sustainable cube and say that okay fine, this is my world and this is my area where I will, kind of constrain myself within these four walls and domains. So eventually, of course, neither will I be able to adapt to what is happening outside, or neither will I be able to collaborate. So somewhere it's very important to network with peers, have cross, you can say national collaborations, view other, you can say models of polity systems about, you can say how they have, innovated. And that will only happen when we are flexible. So we don't hold grudges against certain geographical, you can say, restrictions. Now, an example could be like if I'm just to sound politically aligned, I might find some good healthcare standards from maybe the American Union or from the European Union, and they have worked hard to see that those standards have, kind of uh, taken shape, and there is a very good effective rate of its adaptability. A simple example could be like, say, hand washing. So we could always refer to the WHO guideline. But suppose if I have to say, oh no 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 no, I'm in India and oh, I'll kind of stick to my old fashioned pattern of hand washing as I do it. So somewhere, of course, I'm not only losing out on the better practices, the better effective, because somebody actually sat down to study hand washing. Somebody actually sat down ki how your steps of hand washing are going to impact the flora and fauna of bacteria or the germs in your hands. Somebody did a very, you can say, niche research on those areas, and of course sharing those good practices is only possible when we collaborate globally. Of course, I might have some good practices in India, and I could deliver that across to my international peers. So we could collaborate, we could learn, and of course, as we evolve, we have to adapt. The environments are changing, the patterns, the economies, globalization has taken a lot of, you can say initiatives where things have become much different than what were 10 years back. So adaptability is key. And finally, as John Ruskin has correctly said, quality is never an accident, it is always the result of intelligent effort. So, with that, I would like to end my webinar and open the ground for questions now. So, if there are any questions, we can discuss.